Tonight, Utah taking a side in the renewed debate over fluoride in drinking water. On Thursday, Governor Spencer Cox inking a law that bans adding the mineral to public water sources starting in May. Years of research have found adding fluoride to drinking water reduces tooth decay up to 25%.
Hello everyone, my name is Dr. Mo and I'm a licensed dentist. I'm devastated to hear that the state of Utah has formally announced that they're going to stop adding fluoride to the drinking water. Let's watch the video together and I'll be giving my opinion in relation to this.
That practice began in 1945, known as fluoridation.
The Centers for Disease Control and Prevention included it as one of its 10 great public health achievements of the 20th century because it literally changed the face of America.
The American Academy of Pediatrics and the American Dental Association both support its use.
Fluoridated.
So this is actually true. The ADA, the American Dental Association, is a very reputable source, and they're in support of having fluoride and fluoridated toothpaste. So I'm surprised with this decision taken.
Water is medicated water.
But the movement to ban fluoride has gained popularity across the country, with proposed legislation in Florida, Kentucky, Montana, and Tennessee.
It was the only chemical we add to our water that's intended to treat the consumer and not the water itself.
The Fluoride Action Network says more than...
So they just showed the map of the states that are now in talks, I guess, for having a similar decision. And that is what happens. So when there's one of the states that issues that announcement with a ban of fluoride in drinking water, will other states that are going to now question, should we also ban fluoride in drinking water? And a lot of the trending searches are, is fluoridated water bad? Or is there any problems that fluoride causes? It will raise a lot of questions that we will answer in this video.
Than 1,500 communities have stopped adding fluoride to their systems at the local level since 2010.
I would say I just feel like it should be a choice of each person.
Health and Human Services Secretary Robert F. Kennedy Jr., among the most vocal of critics, posting on X late last year that the incoming administration would advise all U.S. water systems to remove fluoride from public water.
I think fluoride is a poison.
The secretary associating fluoridation with illnesses like bone cancer. The CDC says scientists have not found enough evidence to support a link. One JAMA.
So the CDC is another very reputable source in relation to healthcare, and I'm not sure about these claims. With all due respect to RFK, fluoride, as the scientific evidence that we have right now suggests, wouldn't be necessarily dangerous unless if you ingest toxic levels of fluoride, or fluoride reaches toxicity levels in your body, if you're swallowing excessive amounts of whatever that contains fluoride, right, whether it's toothpaste or otherwise. Let's say if you live in a community where there is a fluoridated water and you have other ways for the consumption of fluoride, and you also take fluoride in the form of supplementary pills, this is where you actually could be at a danger of having your body reach toxicity levels of fluoride and having also adverse effects from elevated levels of fluoride. But just let's say modest or appropriate levels of fluoride in fluoridated water, that's a lot of fluoride mentioned, generally speaking shouldn't be that much big of an issue.
Pediatric study published earlier this year did find an association between higher fluoride exposure and lower IQ scores in children, but the American Dental Association says the data is flawed.
3/4 of the studies that were included.
So just because a study says something, it does not mean we just unleashed the truth. We have to assess the quality of that study. the type of that study, who was funding that study, were there any opinions that were biased, especially here where we have two camps, like camps that are supporting fluoride and fluoridated water, and one that is really anti all of this, meaning against all of this.
It were, by the author's own admission, very low quality studies at very high risk of bias, none of which were from fluoridated areas.
Miami area dentist Raul Gonzalez.
So that's what I was saying. It really is important to factor in if there were any biases, the quality of the study itself. I mean, all of these things should be taken into consideration when we say, oh, a study said this or a study concluded that. Now we have a dentist to give, their opinion.
Gonzalez says he's noticed some issues in some patients who are avoiding fluoride.
I'm seeing a lot of new patients with my 5 doctors here that we're seeing a lot of cavities coming back because there's a lot of propaganda saying that fluoride is really bad.
Dr. Gonzalez says becoming hyper-focused on fluoride can draw attention from other important risk factors for whole body health.
Most important thing is good dental hygiene. Brush.
So fluoride has a lot of positive effects in relation with your dental and oral health. Adequate levels of fluoride, even fluoride in a topical form for your teeth, based on scientific evidence, will make the teeth more cario-resistant, meaning more resistant to caries and cavities forming. Also, it will affect your teeth at a structural level, i.e. the bonds and like how the microstructure of your teeth will be altered with the fluoride. And when I say altered, I mean in a positive way against caries and decay.
Floss the water pick. Second, eliminate the sodas and the drink that have bubbles. Now you add to that sugar and you add to that colorants, now you have cavities, digestive issues, and the probability of cancer producing or cancer transforming cells.
And George Solis joins us now from our Miami bureau. George, as you were speaking with dentists, did any of them mention a circumstance where fluoride could be dangerous?
Yeah, Elson, it's important to note, according to the CDC, the real only documented negative effects of too much fluoride would be a discoloration of the enamel, that covering around your teeth, and small holes. But even in countries where there is high levels of fluoride, it far exceeds anything that we see here in the United States. And as you heard from the dentist there in our report, Dr. Gonzalez there, look, anything in excess is not good for you. He says what we see here with our moderate levels of fluoride in our water shouldn't be harmful, but of course the best thing to do is to obviously check with your dentist, check with your doctors about any concerns you may have about fluoride.
So that's all for today. My name is Dr. Mo Dentist, and don't forget to follow the channel.